Suspect you or a loved one might have sleep apnea? Getting started is critical because the condition often goes undiagnosed, yet it can have significant health impacts. Here's an overview of common approaches for screening for sleep apnea. There's self-assessment questionnaires. They're very common screening tools used to identify those at risk for OSA. They assess snoring, tiredness, observed apneas, high blood pressure, BMI, age, neck circumference, and other gender-specific information. Examples would be the Epworth Sleepiness Scale, the Berlin Questionnaire, and the Stop Bang Screener. These tools are quick, easy, and non-invasive, and often used in primary care as initial indicators for further testing. There's also overnight oximetry. It's a simple test that more reliably identifies those at risk by measuring nighttime blood oxygen levels with a small device on your finger while you sleep. While it doesn't diagnose sleep apnea, it reliably identifies those in need for more detailed testing. After screening, generally diagnostic testing is performed in one of two ways. An in-lab study, more commonly called polysomnography, or simply just a PSG, is a comprehensive assessment that monitors brain activity, eye movements, heart rate, breathing patterns, oxygen level, and body movements during sleep. PSGs are recommended if there are complex symptoms or concerns about other health problems, such as central sleep apnea, hypoventilation syndrome, or cardiopulmonary issues. Home sleep tests, called HSTs, are portable devices used at home, typically for people with high likelihood of obstructive sleep apnea, but without other significant health issues. These tests measure breathing, oxygen levels, heart rate, and sometimes additional factors while you sleep, and they have become standard of care since we can do multiple night studies for the same patient. There exist three forms of therapy for obstructive sleep apnea. The most common is CPAP, which is very effective therapy for those patients that can actually tolerate wearing it throughout the night. The most common alternative is an oral appliance, also called mandibular advancement device. These custom-fit appliances are easy to wear and have their place for those with mild to moderate forms of the disease or for those with severe sleep apnea that find themselves unable to tolerate their CPAP. Inspire is a surgical procedure that implants a device designed to keep the airway open at night. Those wanting to be screened, know more, or explore their options can click the picture below and you will be sent a link and provided a free screening opportunity. Dr. Bozes, whose practice is limited to testing and treating those in our community that have sleep apnea, will, after interpreting the results, reach out to you with a no-obligation explanation of your options. Snore, think you might be at risk for sleep apnea? Or perhaps you've already been diagnosed and simply hate your CPAP. We can help. Give Dr. Bozes a call at 307-265-3595, as our practice is limited to sleep disordered breathing, more commonly called sleep apnea.